How do I protect myself while lifting or moving someone? You lean over to help your loved one out of bed and snap, you're back. Does that sound familiar? If it does, you're not alone. Most caregivers aren't taught how to safely lift or transfer someone, and over time that strain can lead to pain, injury, even burnout. In this video, I'm going to talk about how to protect your body during lifting, transferring, or daily care routines. You're going to learn some techniques that reduce strain, some tools that can make the job safer, and a few shifts that might surprise you. I'm Dr. Anna Thomas. I'm a physician, TEDx speaker, and founder of Life Care Leadership. I created this podcast, The Age of Caregiving, to give you the tools, structure, and support to lead care with clarity. Whether you're navigating a new diagnosis or you're juggling care on top of everything else, you're not alone. Please remember, everything I share here is for educational purposes only. Always consult your healthcare provider for any personal medical advice. Now, if you're caregiving without a roadmap and you feel like you can't take a whole lot more, please check out my book, From Caregiver to Care Leader. It is full of strategies to help you care smarter, not harder. It's available on Amazon. So let's talk about why caregivers get hurt more than they realize. Caregiver injuries often don't happen in one dramatic episode. They build over time. Lifting with a twisted posture, catching a loved one who starts to fall, helping someone stand without the right support tools, moving them in bed without the right positioning. These repetitive micro strains can lead to chronic back pain, neck, shoulder injuries, wrist or knee strain, and burnout from the physical exhaustion. But here's the good news. Small changes in how you move can protect your body long term. Rule number 1 is to use your legs, not your back. You've probably heard it before, but here's what it means. You bend at the knees, not at the waist. You keep your back straight when you're lifting. You hold the person close to your body when possible and avoid twisting while you're lifting or transferring. Think of yourself like a squat machine, okay? A squat machine, not a crane. Now, if you're doing something and it feels awkward or painful, stop, reassess. Pain is your cue. It's not a badge of honor. You need to stop and protect yourself. Rule number 2 is to keep things close and low. One of the biggest lifting mistakes is reaching out too far, okay? You want to keep your loved one's center of gravity close to you. Position any chairs or beds so that you're not leaning over awkwardly. Bring their feet under their knees in the right position before you get them to stand up. This will help them shift their weight forward and make standing easier. If they're too low on the bed, don't yank at the shoulders. You can use a draw sheet or a sliding device to gently reposition them. And if you're not sure how to use these devices, your best bet is to ask your doctor for a referral to an occupational therapist who can teach you how to do all of these movements safely. Rule number 3, don't lift more than what you can safely handle. Ask for help. You might be surprised that this is the hardest rule because it feels like you're supposed to be strong enough, but caregiving is not a one-person job. Please ask for help with transfers whenever possible. Use tools that reduce lifting needs and be honest about your own limits. This is not a weakness, it is wisdom. Protecting yourself is not selfish. It's how you sustain your care. Let's talk about some helpful equipment that can make lifting safer. And you do not need a hospital setup. Sometimes just a few tools can make a big difference. One tool are gait belts. These are belts worn around your loved one's waist, giving you something safe that you can grip during transfers. Another item is known as a transfer board. These are flat boards that help slide someone from one surface to another, like from a bed to a wheelchair. Another item to consider are called pivot discs or transfer pulls. These are discs that will turn. Instead of you doing the manual turning, the disc itself will turn. This can help with standing and pivoting onto a chair. Another item that I always encourage family members to consider are shower chairs and grab bars in the bathroom. This can make bathing safer and reduce the need for them to be holding on to something the entire time. Slide sheets, friction reducing pads. This is something else that you can use to let you reposition someone in bed without pulling on their skin or their clothing or twisting your back in the process. Ask your loved one's doctor about what tools are best and if you can get an occupational therapy referral or even a physical therapy referral. Many times these are covered by insurance for a short period of time, and the therapist can assess what is the best equipment to use as well as teach you how to use it. Your health matters just as much as that of your loved one. You can't help anyone if you've both fallen down. If caregiving is taking a toll on you, then please check out my book, From Caregiver to Care Leader, to help you shift from strain to structure. Grab a copy on Amazon and start leading caregiving with your whole self in mind. Remember, you're not just lifting your loved one, you're lifting this entire responsibility, physically, emotionally, and mentally. But here's the truth, you can't carry it all if your body breaks down too. You deserve support, equipment, and strategies that make this work sustainable, not punishing. Because caregiving isn't just about strength. It's about smart, skillful leadership. And that starts with protecting you. If you want to understand why rest and relief are just as important as safe lifting, then go back and watch How Can I Take a Break Without Feeling Guilty? It's a reminder that every caregiver needs. Remember, you are more than just a giver of care. You are a leader of care.